Good day, sir, and this is our video presentation. Number 1 question is, what is the designer drug? Designer drugs are pharmacological compounds manufactured in laboratories with the intention of emulating the effects of sometimes legal, more often illegal drugs. The rationale behind their invention runs a more complicated spectrum and sometimes goes beyond just illegal purposes. The purpose of its creation is composed into 2 reasons. Number 1 is illicit motivations, evasion of drug laws. Designer drugs are usually made by making changes in the molecular structure of the existing drugs, thus creating a new substances that are not clearly stated as prohibited. In this manner, the manufacturers takes advantage of the legal loophole and carry on with the production of the said drugs. Next is increased potency. Designer drugs are made with the intent of being more potent than the original drugs, thereby providing a better, high, and greater returns for the manufacturers. Next is avoidance of detection. Avoidance of detection due to the changes in the chemical structure. Designer drug pass low-cost drug tests even when it is not recommended, hence appealing to those who want to keep off drug-related legal issues or don't want to screen during their workplaces. Number 2 reason, the undeniable reasoning. First, finding treatment. Banning certain designer drugs is unfortunately necessary because they are developed through the research of a new drugs for the sole aim of misusing them for illegal pleasures. Number 2, intellectual property. Many times the drugs companies may carry out research and come up with drug types with exaggerated structure and acquired for patenting and market monopoly inclusivity, thus causes for creating designer drugs that could fit similar orthodox medication but with different chemically designer structures. Example of designer drugs is fentanyl analogs. Fentanyl analogs are synthetic opioids that exhibit more strength than heroin and have been implicated in rise in overdose cases burden. Most of the time, they are produced in illegal factories and are present in forged pills or blended with other substance, which complicates the ability of the consumer to determine the dosage and the dangers involved. My next reporter will explain the effects and the nature of the drug designer of fentanyl analogs.
The nature and effects of fentanyl analogs. Chemical structure. Fentanyl analogs are synthetic by nature and share some structural similarities with fentanyl, an opioid used as pain relief. Nevertheless, these compounds are frequently altered chemically, which become the reason for different potencies and effects. Potency. The potency of involved substances has been shown to be much higher than the heroin and fentanyl, even drugs may be deadly. Effects. The effects of the analogs of fentanyl are comparable to the effects of other opioids, such as euphoria, sedative effects, and relief of pain. However, because of their high potency, they may cause deep respiratory depression, slowing breathing to a point of death. Risk of overdose. The high activity and unpredictability of the effects of fentanyl analogs enhance the chances of unintentional abuse and its consequences. Signs of overdose include a decreased rate of breathing, contracted pupils, delirium, excessive sleepiness, and fainting. In summary, the issue of designer drugs, and in particular that of fentanyl analogs, represents a public health risk of global proportion due to their verifying strengths and possibilities for their abuse and production. Therefore, the need to make the public more aware about these substances is warranted. And not only that, but also the need to protect people from the increase in such substances by controlling their production and distribution is important.